In Western Kenya's busy maternity wards, life often begins in uncertainty. Here, the first cry of a newborn baby is not always guaranteed, and survival can hinge on minutes, milliliters, and grams. In Kenya, an estimated 134,000 babies are born prematurely every year. Arriving before 37 weeks of pregnancy, many weigh less than 1.5 kilograms, too small, too fragile, and too early. While some cling to life inside incubators, others rest on their mother's chest in Kangaroo Mother Care, a simple but life-saving practice, skin-to-skin warmth, which is an alternative to costly technology. Amid the green farmlands of Bumula and Bungoma County lies a story of faith, pain, and unyielding love. For one mother, Maureen Mulongo Sifuna, every heartbeat for her child was a battle against time. As a nurse, Maureen has had 2 preterm babies. Prior to this, in her previous pregnancy, fibroids led to a delivery at 31 weeks, but she lost that baby. Doctors had reassured her that fibroids were reducible, giving her hope for the future. This second pregnancy brought relief. There were no fibroids, but new challenges emerged. She endured constant abdominal pains and backaches, carrying the weight of worry every passing week.
I delivered my baby in 2022, October, at 31 weeks. She was weighing 1.3 kgs. We were taken to NBU, and after 4 days, she was weighing 1.1. I was so demoralized as a mother. You know, when you are there, you put the profession aside. It is the life of your child you are dealing with. So anything to do with the profession, like it can't ring your mind. I felt like I was losing her. But the support I got from the nurses, the doctors, my friends, my family, it kept me going.
Doctors called her a miracle child, a child who defied all odds. She was not expected to survive given how fragile she was. Maureen stayed at the hospital's newborn unit for 3 long weeks before being transferred to Kangaroo Mother Care, where the baby began to thrive. Under the warmth and closeness of skin-to-skin care, she gained weight steadily, much more than in the nursery, where contact with the child is limited.
In NBU, you are not so much in contact with the baby. We have some hours for feeding. At least you will see your baby. Sometimes they are on oxygen. But in a kangaroo, you are with your child. Your child is always on your chest. Like you meditate on your child, that bond, that motherhood, you see, you feel so good more than when the child is in NBU. Kangaroo is much better for psychological and physiological of the baby and the mother. Kangaroo is more better because you are always with the child.
Through the long, exhausting days, she was never alone. Her husband, Chrysanthus Martin Haembe, stood by her side, giving her the strength to keep going. His presence, encouragement, and constant care became a lifeline not just for her, but for their tiny fighting baby.
They provided everything I needed. They encouraged me. They brought me food, tea, pampers, and everything. Like they were there for me. They feasted every day, even 3 times a day. As a mother, when you are stressed, even the milk production will reduce. But when you have the support, you know that there are people who care for you. You are also encouraged. and there will be more production of milk, and you will also have that spirit of continuing to take care of this baby.
For Mr. Haemba, now a retired police officer, fatherhood was a journey of hope dotted with heartbreak. From the loss of the first baby, he was afraid the same may happen again.
The first one, when I passed away, I was not around. Kwa mbali, kasaliwa akapelekwa kwa nursery. Unfortunately, he passed away. But with this one, alisaliwa nikiwa niko. Kwa hospitali, kaenda huko kama ni ajisikii mzuri, lakini bahati mzuri akajifungua, nikaenda nikamuona, lakini mtoto alikuwa kwa pahali yako simuoni. It's a restricted area.
Together, they followed every instruction from the doctors and nurses, determined to give their fragile child the best chance at life. And it worked. Weeks later, after careful care and Kangaroo Mother Care, their baby thrived. Today, 3 years on, Kate is healthy, smiling, and full of life, a living testament to a father's steadfast presence, a mother's courage, and the quiet power of love in the face of despair. From Bumula, we head to the quiet village of Mundulu in Shinyalu, Kakamega County. Dawn breaks like any other day. But for Keran Mbone Lumumba, May 17th began with a shock that will change her life forever.
Kama kawaida naamkanga saa 11 asubuhi kutayarisha watoto wenye wanaenda shuleni na mimi mwenyewe niende kazini saa 2. Hiyo saa 11 asubuhi nilijihisi tu kukojoa. Kwenda kukojoa yenyewe iliendelea tu bila kusimama. Nikaitisha mtoto tochi. Juu nilikuwa nje tu karibu na choo. Kuangalia ni damu. Nili overbleed tu. Kwa hiyo harakati nikaita mtoto. Nikamwambia ita baba. Nikamwambia na bleed. Akaniuliza ni kwa nini. Nikamwambia hata sijui. Sasa akaona tu itasimama, lakini iliendelea kufika saa 1 ilikuwa imezidi. Walingangana kutafuta gari, walipata ambulance ya Mukumu. Vile iliingia mtoto akatoka tu kama nimefikia sitting room. Mtoto alitoka na alilia. Hao madaktari walikuja wakanibeba, wakanipeleka ambulance, wakanipeleka mpaka Mukumu. Chenye walifanya haraka ni kusimamisha damu, wakaniosha tumbo. Kupinduka kwenda kuona mtoto ni mdogo. Wakaniuliza shida ilikuwa nini mama? Nikawaambia niko na mtoto wa miaka 2.5. Tangu nizae huyo mtoto nilichukua family. Sijaenda period.
Earlier, when she missed her periods, Mbone had sought help at a private hospital where she was told the swelling in her abdomen was likely a growth. Believing this, she went on with her life unaware that she was actually pregnant and later had preeclampsia, a pregnancy complication marked by high blood pressure and organ stress which had triggered premature labor and delivery.
Kutoka Mukumu tunapelekwa general, mtoto akawekwa oxygen, akawekwa kwa incubator, akawekwa maji. Akakaa siku 4. Siku ya 5 ndio naitishwa kutoa maziwa sikuwa nayo. Waliningangana kunipa madawa, nikamezako, nikakunywako maziwa, chai ya koko, maziwa ikaanza kutoka. Kwenda kupima mtoto amebaki 900 grams. Walingangana nilikuwa natoa hiyo maziwa after 2 hours. Nikitoa nikipeana akitumikia kwa mpira. Amekaa kwa nursery 1 month akiwa incubator. Walimtoa incubator after 1 month, wakanipeleka Kangaroo room na huyo mtoto. Kangaroo room nilikaa hapo 1 week. Nilikuwa nakaa na mtoto mchana kwa Kangaroo kwa matiti. Na usiku wanachukua wanarudisha kwa incubator.
After 2 months in hospital, they were finally discharged. With a prevalence of 7.14%, preterm birth is among the leading causes of newborn deaths in the country. Kenya records 21 neonatal deaths per 1,000 live births, which is well above the global target of 12 by 2030. The World Health Organization estimates that each year 15 million babies are born too soon, accounting for about 1 in every 10 births worldwide. World Health Organization data shows that prematurity is also the leading cause of death among children under 5, with the burden highest in low and middle income countries. Across sub-Saharan Africa, Rwanda stands out as a beacon of progress in newborn survival. Despite facing similar economic and health system challenges as Kenya, the country has dramatically improved neonatal outcomes through the power of strong networks of community health workers. More than 90% of births take place in health facilities, and the widespread embrace of Kangaroo Mother Care have all contributed to reducing preterm related deaths. The Rwanda Every Newborn Action Plan 2020 to 2025 shows neonatal mortality has now fallen below 15 per 1,000 live births, a remarkable achievement. In India, where more than 3.5 million preterm babies are born each year, innovation has also been key. UNICEF's 2023 report credits models like the special newborn care units and home-based newborn care delivered by trained community health workers for transforming survival rates. In Kakamega and Bungoma counties, the fight against preterm births spans from community outreach through to neonatal units. About 30% of babies admitted in Bungoma County Referral Hospital are preterm compared to the national average of 12%. The causes are wide, ranging from maternal, placental, and fetal issues. Preeclampsia, malaria, and HIV heighten maternal risk, while placenta previa, abruption, and accreta threaten the viability of pregnancy. In Bungoma, high school teacher Grace Hasula still remembers the panic of delivering at just 7 months. She had spent weeks on bed rest after doctors diagnosed her with a placenta previa, a complication where the placenta is too low and can block the birthing canal. One evening, after cleaning her bathroom for the first time in months, she noticed bleeding. Hours later, she was in the operating theatre at Bungoma County Referral Hospital for an emergency cesarean section. Hasula's daughter weighed 2.04 kilograms at birth. For 20 days, she stayed in the newborn unit, followed by 10 days in Kangaroo Mother Care.
That day, when I got the baby, I didn't expect her to be so tiny because I thought she'll just come as other babies, normal size babies. But unfortunately, she was tiny. I got scared. I was worried. Then when I was sure that this is your baby, I didn't even believe it at first. I almost left her there. But they encouraged me to stay, and they told me, this is your baby. She's going to grow. And I got positive about it. When she was born, she had artificial asphyxia, whereby she could not breathe properly, and she was put on oxygen. Then after the surgery, I took longer time to breastfeed her, which led to jaundice, and she was put under the jaundice treatment machine.
Adjusting to Kangaroo Mother Care was not easy for Hasula. She recalls how nurses instructed her to hold her tiny baby against her bare chest to keep her preterm baby warm as she bonds with her.
I was scared, I cried, and I thought I was going to lose my baby. But the doctors encouraged me and told me that this is something that happens, and it happened for a reason. And there are so many babies that have been born under age, and they have grown into big babies, and they are now all grown. So through that, I was encouraged, and I took good care of the baby. All the medications that were prescribed, I bought them, and the baby was treated well, and we were later discharged.
According to Hasula, premature babies are very costly to take care of.
Right from birth, there are so many drugs that need to be bought. And after giving birth to a preterm babies, some mothers like me, I had what we call postnatal depression. And when you have that postnatal depression, you don't have milk. You won't have enough milk to breastfeed your baby. So it was a challenge. The baby is crying, you are also crying, and you need to breastfeed her, and there's no milk, totally no milk. So it was hard. Now you have to chip in, you have to buy naan, of which not everybody can afford the naan. You have to buy the naan so that to supplement the milk. There's one that costs 1,800 and another one is 2,200. And it only takes 3 months. From the time she was born till now, every month you have to buy, you have to buy, you have to buy. And that is a lot of money.
Dr. Felicitas Makoha says prematurity is among the most common and devastating conditions at the newborn unit.
The common conditions of babies admitted to this newborn unit, number 1 is prematurity, number 2 is birth asphyxia, and number 3 is newborn infections. So the burden of prematurity in this county, 30% of the babies we admit to the newborn unit are preterm. Nationally, the preterm rate for Kenya is 12%. 12% of all births in Kenya are of preterm babies. And some of the risk factors for preterm delivery include maternal factors, newborn factors, and placental factors. So if I expand on each, for maternal factors, it includes maternal conditions, mainly pregnancy-related hypertension, commonly known as preeclampsia, is one of the conditions that is commonly associated with prematurity. We also have infections like malaria, HIV also contributing to prematurity. Extremes of age, if you have mothers who are very young, the teen mothers and the older mothers are at risk of having preterm babies. When you go to placental factors, placental abnormalities like placenta previa, placenta abruptio also contribute to babies being born preterm. The moment the mother starts bleeding, the baby has to be delivered regardless of the gestation age. For fetal factors, multiple pregnancies, like in this county, there's a lot of twin and even triplet pregnancies. Those who are multiple tend to be born before their term. And also congenital infections like CMV, toxoplasmosis, rubella can also contribute to babies being born preterm.
The hospital's newborn unit, built for 60 babies, often holds far more, sometimes up to 150 admissions monthly. Most preterm cases in Bungoma, Webuye, Kimilili, and Sirisia end up here. Bungoma County Referral Hospital in 2024 had 800 admissions, 560 discharges, translating to a survival rate of 70%.
Most of the preterm babies are sent here because here we are able to do respiratory support in form of bubble CPAP, and since as the specialist I'm stationed here, most of the babies who are complicating are referred here. In the care for these babies, we don't just wait for them to come here. When we have high-risk mothers coming in, like those who have PET, we go to theater or to the delivery room to receive them from there, and the care starts from there. So Kangaroo Mother Care is one of the low-cost, high-impact interventions that we use to take care of preterm babies. And Bungoma County has been practicing Kangaroo Mother Care since October of 2014. And our starting of KMC was informed by the need for care. Preterm babies ideally should be taken care of in an incubator where they receive warmth and humidity. Unfortunately, we don't have many incubators. Currently, we only have 4 incubators. So we ended up adopting Kangaroo Mother Care as one of the methods for taking care of the baby. So we normally start that KMC from here, even before the mothers go to the KMC room. We start teaching them about the benefits of Kangaroo Mother Care. Once the babies become stable, like the ones you see here, this baby was born with 850 grams. This one was born with 1,000 grams. We have been taking care of them now. They are stable. We have weaned them off oxygen. Once they are stable like this, the mothers can start doing what we call intermittent Kangaroo Mother Care here before they move to the KMC room. The current teaching is that we start KMC immediately after delivery.
In preterm care, survival is not just medical. It is emotional, financial, and deeply human. For some, joy and grief live side by side. Bridget Naliaka from Mabusi in Tongaren constituency remembers vividly the day she went to give birth at Tongaren Sub-County Hospital. She was expecting twins.
Nilipojifungua alilia wakati nilimjifungua, lakini wa kwanza hakulia, but wa pili alikuwa black, lakini baadaye akakuja akawekwa kwa oxygen akaanza kuturn color. Baadaye kidogo nikaletwa Bungoma tari, akawekwa kwa nursery. Watoto wakawekwa kwa oxygen. Baada ya wiki moja, mmoja akafariki, mmoja akabaki.
A 27-year-old Angela Nafula Barasa from Kitabise village recalls the long and frightening journey of bringing her twin daughters into the world.
Wakati nilienda scanning, picha ilionyesha vichwa ziko juu, miguu iko chini. Na daktari akaniambia kama utasikia uchungu yoyote uende tu hospitali yenye iko na operation. Ndio maana ilikuwa tarehe 3 Ijumaa, nikakuja huko asubuhi Bungoma kwa sababu nilikuwa nasikia maumivu. Na vile nilifika huko maumivu iliendelea hivyo hivyo mpaka saa 11 jioni. Na nikazaa mtoto mmoja vizuri, alafu mwingine akakujia miguu. Ndiposa nikaenda kufanyiwa CS saa 5 ya usiku. Sasa saizi watoto walipelekwa NBU tarehe 3 saa 6 ya usiku. Na waliendelea na matibabu, sijaona shida yoyote kwao, wako salama. Saa hii nimeletwa kwa room ya KMC na wanaendelea salama.
At Bungoma County Referral Hospital, care for preterm babies doesn't end at birth. Doctors here supplement the infants with vital nutrients that would normally be transferred from the mother during delivery. These supplements help fragile babies grow stronger as they begin their journey to well-being.
Some of the mitigating factors that we are now putting in place to reduce preterm rate is implementing what we call high-risk antenatal clinic. As a facility, we run a high-risk ANC every Thursday. So we encourage our lower-level facilities and community to refer these high-risk mothers, the categories that I mentioned, the ones who are too young or the ones who are much older, those who have history of getting preterm babies, those who have pregnancy-induced hypertension, diabetes. So they come here where they are seen by obstetricians and they are able to take care of them so that these pregnancies can be taken care of early. We also have a point of care ultrasound, POCUS, which we use to do fetal surveillance so that the babies can be monitored when they are in utero to be able to survive.
Across the border in Kakamega County, a similar fight unfolds. Kakamega faces overwhelming demand in its newborn unit. With only 6 beds, space is a daily struggle. Here, premature babies battle complications such as respiratory diseases, hypothermia, sepsis, and jaundice, managed through CPAP machines, incubators, Kangaroo Mother Care, strict hygiene, and phototherapy. Beverly Wambani says the county continues to record high numbers of preterm births.
These teen mothers, of course, they have not matured enough, they're babies, and we even have the age of 14 to 10 to 14 years, and even up to 19 years who are giving birth. So, they have not matured, and so when they get pregnant, the chances of them having preterm deliveries is normally very high.
Until recently, Kakamega County had just 1 newborn unit, but new facilities in Likuyani, Malava, and soon in Butere are transforming access to care, bringing life-saving services closer to families. The Kangaroo Mother Care (KMC) method, developed in Colombia, is saving thousands of preterm babies across Kenya and Africa. It allows mothers to use their own body heat to stabilize babies who can't afford long incubator stays. Even though most mothers come from rural areas and have never heard of Kangaroo Mother Care, after a few lessons, they strive to see to it that their babies live.
These mothers in adapting in KMC, they're from the village. They don't know what KMC is. So immediately, and they're not prepared. They were not prepared to get a preterm birth. So we normally take them, we have a counseling room to tell them what we expect from them to adopt. She's worried, why did I give birth to this tiny baby? So we first counsel her to accept that baby will either survive or die. 2 chances. But we normally strengthen that with your help and with my help, we shall ensure that your baby will do what? She will survive. Now, what we normally do, we take them through counseling session. You ask if she has a couple, that is the husband or any other person of help. When that mama tells you there is help, now you come, you teach her what is kangaroo. It entails skin to skin care. What will be required? We require a cap and socks and diaper. So you ask, is someone providing for you diapers? You assess the social status of that mama. If she can't afford the diaper and the lesson and the socks with a cap, the hospital provides.
From grams to kilos, from fear to faith, Kenya's mothers of preterm babies continue to teach the world the meaning of resilience. For Willow Health Stories, I am Sarah Kamande.